Dr. Henry, an 81-year-old man in the Fraser Health region is dealing with a mix-up regarding his second dose. So essentially, he says he hasn't received it, but the health authority says he has. Now, I understand you can't comment on a specific issue, but generally, is there any harm in receiving an additional dose of the vaccine if there is any doubt about whether or not you have received two? And would a third dose be bad for your health?
Yeah, and the short answer is no. And, it is unfortunate. Sometimes these mix-up happens. I think I said today we're over 4 million doses of vaccine given, and even 60,000 doses yesterday. So sometimes, unfortunately, people get mixed up. And no, there's no harm to one's health. There's no risk for getting a third dose. It won't count as a third dose. Essentially, it just is the same. If you get them too close together, your body doesn't recognize it as more than one. So, but there's no adverse effects that we know of. There can be an increased sore arm and a local reaction if you're getting a second dose too soon, but that would be the extent of it, really.
Zara, do you have a follow-up?
Yes, thank you. Dr. Henry, can you give advice for people who received AstraZeneca about how long they should wait after their first dose to get their mRNA vaccine if that's what they choose? And you've mentioned a longer interval between doses might be valuable. So can you define longer? Is that 8 weeks or 12 weeks? And can we also get that answer in French as well, please?
Oh, I wish I could. I wish it was black and white. But what we can say is that we don't actually know what the optimal interval is yet. But there is mounting evidence, and I think most of us would agree, that the short interval of 3 or 4 weeks that was used in the clinical trials is probably not the optimal interval. But whether there's evidence to say that 8 weeks is better than 10 weeks, or 10 weeks is better than 12 weeks, or 12 weeks is better than 8 weeks, that we don't yet know. And we don't yet know for other series of vaccines against viruses like hepatitis and others. It actually is better, longer lasting if you get it about 6 months. But we have not yet had these vaccines for that period of time to be able to know how long immunity lasts. So the bottom line is it's somewhere probably anywhere between 8 to 12 weeks is what we are using right now, is probably better than the 4 weeks. But somewhere in there is okay. And so I can reassure people that are up to 16 weeks and that there's also data that shows that that's just as good too. Your body doesn't lose its immunity in that short period of time. And that is a short period of time in terms of our body's immune response. So even up to 4 months or 6 months, we haven't measured up to 6 months yet, but even up to 4 months, we know that that first dose gives you good immunity. And you might even get a more durable, longer-lasting effect after a longer interval. And we've seen that in some older people, but again, it's only measuring the immune response. It doesn't tell us about protection in the real world. But protection in the real world does seem to be a little bit better if you waited a little longer between those doses. And I know we were talking with our colleagues from the U.S., and that's why they are spending a lot of time looking at booster doses, because most of the people in the U.S. received the vaccine at a very short interval. So that may mean that they need a booster dose sooner. We don't know that for sure yet. But I can just reassure people that anywhere 6 weeks, 8 weeks, up to 16 weeks is all safe and will all work, and the longer is not going to harm you in any way.